My name's Rob Gilbert. I was diagnosed with periodontal disease probably about 11 years ago. I got to a point where I needed to have something done about it, and I was recommended to have an all-on-4 procedure done with that. And so it was a little intimidating at first to have something done like that, but I'd done a lot of research. I'd been to a lot of the schools around here, USC, UCLA. I'd found Dr. Jivraj through a couple of referrals and heard excellent things. He's a professor at USC. He's written books on a lot of this stuff, and so I felt very comfortable with the work he'd done and the referrals I'd gotten from him. As far as the procedure goes, I worked with Dr. Zarenkelk. I was the oral surgeon, and he was fantastic. He did he extracted all my teeth, and then he placed the implants. And so previously, some doctors would recommend grafting some bone tissue into my mouth, which sounded kind of intense because they'd be taking it from my hip, placing it in my mouth. There'd be a lot of a healing period from that. Dr. Jivraj had talked about no need for that, and that we could try and just go straight into the existing bone that I have. It wasn't a lot of bone, but based off of his opinion, Dr. Zarenkelk's, there was sufficient to do the procedure. So I had the all-on-4 done. I had temporaries. I was wearing teeth right when I left, basically. I mean, I had the procedure done. I drove right over to Dr. Jivraj's office, and he had teeth ready for me to go right away. They were temporaries that I wore for, I think it was about 6 months. And then, more or less 6 months. And then we worked on getting the teeth, my permanent teeth. He kind of listened to what I wanted, and we made some trials and made some adjustments where we needed to, and ended up with an awesome smile. I mean, exactly what I wanted, and I wanted something that was very similar to what I had previously, and he made it look really natural. Nobody questions whether these teeth are fake or real. I mean, they look very similar to what I kind of previously had, a little bit better, I would say, even. But I've been really impressed with his staff, with the work he's done, and with my new smile. So I'd highly recommend him.